Well, this work with alcoholics and intravenous vitamin C led to a lot of work that I did with alcoholics. Provided I had their cooperation, I could detoxify an acute alcoholic within a few minutes, safely. But I had to keep the drip of vitamin C going for quite some time, maybe an hour or more. Otherwise they would revert back to the alcoholic state. But it was very safe, it worked very well. So I then tried it with heroin addicts and others, and it worked equally as well. I also tried it for withdrawal cases of alcoholism and drugs, and found, yes, it worked, it was effective, it was safe, but I had to keep it going for at least 24 hours. And it wasn't always possible to control the patients in that way. So I got a bit disillusioned because I could have alcoholics and drug addicts queued up from here to Sydney. I thought, this is crazy. What we really need to do is get at the big suppliers and stop the supply of these drugs. And that's when I got into trouble that I'd rather not talk about. It became quite dangerous.
I don't understand. I mean, I'm not... Vitamin C is a miracle drug. We can cure alcoholism, drug addiction, sudden infant death syndrome, shaken baby syndrome, toxic shock syndrome.
An excellent question. An excellent question. I'll tell you why it's a miracle drug. You look at water, it has a simple formula, 2 atoms of hydrogen, 1 of oxygen. There's hardly a process that goes on in the body that doesn't involve water in some sort of way. That simple compound. Take water away from the body, nothing works. Everything's dependent on water, you may as well say. It's a unique molecule. It has to be small so it can work fast and get in there and do its job. Well, vitamin C is a relatively small molecule too. And it's specially designed as one of nature's miracle compounds. It can get in there and do its job fast and effectively. And it, in the same way that water does thousands of different things in the body, then vitamin C takes part in, well, I wouldn't like to put a figure on it, but a huge number of reactions. Nature uses it for all sorts of purposes. It's specially designed. It's a unique molecule.
Why isn't everybody jumping on this?
Because they have been indoctrinated. And obviously one must understand it and know. I mean, if I jump over a cliff and keep swallowing vitamin C until I hit the ground at the bottom, 400 foot down, it's not going to save my life. But it needs to be used intelligently in a proper way. But in many conditions, such as acute viral infections and so forth, it won't work unless you give it intravenously and get a high level of vitamin C in the blood.
Maybe, Archie, you can talk about the fact that human beings and only a couple other species are uniquely, don't produce their own vitamin C.
And that's kind of...
Yeah, it seems like it's so valuable that most organisms produce it themselves.
Right, and do you know, and if you know about this, what
Yeah,
the
I do.
evolutionary explanation is for why we don't and they do?
Now, why is it that only humans and monkeys and apes and a few creatures like guinea pigs and the capybara don't manufacture vitamin C in their bodies, whereas cats and billy goats and so forth, and kangaroos, all produce a lot of vitamin C in their bodies. In fact, billy goats under stress can produce huge amounts of vitamin C in their livers, but we can't. Many authorities think that this has been a mutation, that the gene responsible for making vitamin C has been taken out of our bodies. It's a mutation. I think it is probably, and I'm just hypothesizing, I don't really know, but I think it is more complicated than just that. Nature made us in a very special way. We've got huge amount of brain power. We've got the ability to do lots of things that other creatures can't do. And to supply all this power to our brain, nature concentrates most of a huge proportion of the vitamin C that's in our bodies in the brain. And it's not there by chance. Huge amounts are used by the brain, disproportionate to its volume. And I think the reason why, there are several reasons why nature decreed that we should not manufacture vitamin C in our own bodies. First of all, she decreed that we would get more than what we needed eating fresh fruit and vegetables and fresh food in proper ways. In other words, we would have to live in an unpolluted environment, grow our fruit and vegetables properly and prepare our fruit and vegetables properly. And if we depart from those laws of nature, there's a penalty to pay. If we had in our system the ability to manufacture vitamin C, I hypothesize, and this is just an hypothesis which may be far from correct, that would take a lot of extra energy that would not be available for brain power. So it may not be just an accidental mutation. It may be deliberate. And it certainly is a fact that if we depart from what nature intended us to be and do, there's a penalty to pay. So if we continue to pollute the earth, if we continue to eat rubbish, affects our genes. We pass that defect on to our children, on our grandchildren. It gets worse each generation. In other words, we're going to end up destroying ourselves, and we're in the process of doing that right now. And I think that's a very important issue.
Yep. All right. Shall we say enough for today?
Yes, let's
Okay.
do that. And I'll see if I think of other. Kalokerinos, you did a lot of work with Fred Hollows. Are we still?
Yeah.
Oh, okay. With Fred Hollows, could you please explain what Fred Hollows did and his role in eye problems with the Aborigines and the significance of that?
Yes, Professor Fred Hollows,
Yes.
who is Professor of Ophthalmology at the University of New South Wales in Sydney, and an extraordinary man who probably taught me more about important aspects of medicine than anybody else. He became involved in Aboriginal affairs in an indirect sort of a way. But either one or two Aborigines who had serious eye problems, who lived in the Northern Territory, who for some reason or other were brought to Sydney, and he saw them, became emotionally attached to them, and he went up to the Northern Territory and very quickly became deeply involved in Aboriginal health. He told me quite a bit, so I decided that first of all I should just see what the situation was with eye diseases amongst Aborigines in the Northern Territory. So I went up there and started to count, and I was very distressed indeed by what I found. First of all, the number of blind Aborigines, very, very high. And in the first community, I simply counted the numbers that were blind, counted the total number of individuals in the community. Then I looked at statistics that came from overseas. And according to that obviously limited survey, we had in that community the highest incidence of blindness in the world. So I went down to Canberra and gave evidence before the Senate Committee of Inquiry, and there was an enormous public outcry, and it was decided that by the Australian government that they would investigate, and Fred Hollows was chosen to head the team. They couldn't have picked a better man. He would not allow anything to obstruct him. And I remember one example. He did quite a few eye operations at the Alice Springs Hospital on Aborigines. And then he kept touring around Australia looking at Aboriginal eyes, and eventually came back to Alice Springs, and he confronted the superintendent of the hospital and said, "I need to do some more operations here." The superintendent said to him, "No, I won't let you. The nurses complained last time because you made them work too hard." So Fred said, "Okay, if you don't allow me to use the hospital, I'll set up an army hospital right outside the front door of the hospital with television cameras and the works." So the superintendent had to capitulate. When I started, I really knew very little about eye diseases, and Fred Hollows taught me everything that was important. We became friends, of course. He was married to a girl, Gabby, who had talents equal to his. It was a very, very good team. Now, it was the evidence that I presented to the Senate Committee of Inquiry that started the trachoma, which is the eye infection program, off in Australia. It was to be headed by Fred Hollows. And I naturally thought that I would be part of the team. But I was told by Fred that some of the state governments had insisted that if I was part of the team, they would not allow the team into their states. So I was excluded. This was a great disappointment to me for several reasons. I had a role planned for myself. I wanted to train a group of individuals in each community, big or small, to recognise the horrors of trachoma, which is the eye infection that sends people blind, during the early stages. And the treatment is very simple. Nowadays, for example, one tablet of a special antibiotic can cure trachoma. there's an ongoing problem with hygiene and so forth, but generally speaking that is true. And I could have trained a 5-year-old kid to recognise trachoma in the early stages and treat it. So my idea was that when the program was finished, that every community would have a group of people that could recognise the disease and treat it themselves, so that they would no longer need any specialised service. Because at the time, in the Northern Territory, which did have the highest incidence of blindness in the world, there's one eye specialist. So this rather disturbed me. I was also disturbed because the team were not just going to look at eyes, they were going to examine every ear in children in Australia, in Aboriginal children in Australia. And this would have revealed some very important information, because the incidence of otitis media or sore ears in children is a very important guide to a whole lot of things that can happen, including the sudden infant death syndrome, their immune responses to illnesses and so forth. And I was just not allowed to do it. Pushed right out.
Could you describe trachoma and the symptoms and what actually causes it, and what was Professor Hollow's fix for it?
Trachoma is an infection that really hits the eyelids first, and it's painful. And then after some years, the eyelids scar and they turn inwards, so the eyelashes rub on the cornea. Now you may know what it's like to have one eyelash rubbing on the cornea for 1 minute. Imagine having all the eyelashes rubbing on the cornea all the time. And I've got one picture of an Aboriginal woman in that terrible state. During one of my trips to the Northern Territory, I had a meeting when I arrived in Alice Springs with the authorities. And I was notorious for causing trouble everywhere I went. But I only caused this trouble because I could not tolerate unnecessary suffering and the attitude of the authorities. And I just couldn't walk away from suffering which could be fixed. But they persuaded me to try and not have any fights for a fortnight. So I headed off to a particular settlement called Santa Teresa, which was quite a distance from Alice Springs. And I had with me an Aboriginal friend who acted as my interpreter. Helmut, his name was. And Santa Teresa was run by a Roman Catholic priest. Now don't get me wrong, some of my best friends, the finest people I know, are Roman Catholics. But Father Clancy was not one of them. Normally I would just go into a community, I'd introduce myself and tell the people what I wanted to do, and I had Helmut, my interpreter, who acted as who introduced me. And I would just examine the people, whatever I needed to do. But because I had promised that there would be no fights, I first of all went to Father Clancy and told him what I was there for. And he said, well, he said, I won't let you see anybody. And I said, why? And he said, what can you do that's not already being done? He said, if the sisters find anybody with an eye problem, they send the individual into Alice Springs where he's seen by the specialist when he comes down from Darwin. I said, you've got to be joking. I said, one eye specialist for the whole of the Northern Territory? So when he comes down to Alice Springs, he's hardly got time to see any Aborigine, let alone an Aborigine from Santa Teresa. I said, my plan is to import teams of specialists on a rotating basis. I said, I can get them from Adelaide, Melbourne, Sydney, if necessary from overseas. They will all be volunteers. It will cost very, very little. The problem will be solved. He wouldn't agree. Well, I had two alternatives, but I'd promised, you see, being a Boy Scout, I had to leave. On the drive back to Alice Springs, I was trying to explain to Helmut some of the features of the Roman Catholic religion, because he was brought up in a Lutheran mission. I don't know if I should say this, but I'm going to. And when I got to the part where Roman Catholic priests don't marry, Helmut looked at me. He said, do you mean they don't get married? I better not use the words that he used. I said, no, they don't. And then he started to laugh, and he laughed, and he laughed, because that explained to him why Father Clancy was such a bastard. Now, some years later, a couple of years later, I was in Alice Springs for another meeting with the authorities. And when the meeting was finished, they said, well, we're all packing up. Most of them are going back to Melbourne and Sydney. They said to me, what are you going to do? And I said, well, I'm not going back now. I'm going to, tomorrow, I'm going to visit the Todd River. Now, the Todd River was a dried up river passing through Alice Springs, and there's only water in it during exceptional rain. But because it had a sandy bed, Aborigines who didn't have anywhere else to stay used to camp in that bed. And they included a great number of Aborigines, men and women, who drank fairly heavily and were fairly violent. It wasn't really a safe place for any white stranger to be in. So the authorities said to me, that will be a very dangerous thing to do. But I had a young Aboriginal man who was part of that community that I'd got to know, and he was going to come with me and introduce me to everybody, and that's what made the difference. Now, had I gone there by myself, I would have been greeted with hostility, no cooperation. But because I was with that young man who was part of the community, and I was introduced by him, it was a different atmosphere. There's a bit of humour in it too, actually, because really I still had a lot to learn. And everywhere I went, I was surrounded by groups of Aboriginal children who were smiling and laughing and happy, and I thought, gee, these people like me, you know, it must be my personality. I found out later that they were talking to each other with sign language. And unless you knew, you wouldn't even know that they were talking like that. And what they were telling each other was, come and have a look at this bloke. He's worth looking at. Because you see, they'd never seen a person with a nose like mine before in their lives. And they thought it was the funniest thing that they'd ever seen. But at the very end of that walk, which was about a mile or so, my Aboriginal guide said to me, "Come and meet my mother." And it was a terrible sight. This poor woman sitting in the dirt. She had a broken arm in a dirty plaster, and I got a photograph of her that I'm going to show. And in her hand is a dirty rag. And she was never more than a few seconds away from dabbing her eyes because of the pain and the irritation of trachoma. Terrible suffering. To make matters worse, when I talked to her, I found that she was at Santa Teresa when I visited there. And had I seen her in such a state, there's no way I would have left Santa Teresa without her. I would have brought her back to Alice Springs. I would have rung the Prime Minister. I would have had her on an aeroplane, flown her to Sydney, and dumped her in front of Fred Hollows and said there, and he would have dealt with it in the proper, efficient way. But that poor woman had suffered, I can't remember exactly, maybe 2 more years of unnecessary suffering. And I find that hard to tolerate in a country like Australia, because it's not as if Australia didn't have the facilities to deal with this problem. It's not as if there are millions of these people. Unfortunately, I should say first of all that the results of the ear examinations in the children was very important. They found a very, very high incidence, extraordinarily high incidence of ear problems, otitis media and ruptured eardrums and so on. A few years, or some years later, actually, Fred Hollows died. And there was no proper follow-up. And there's nearly as much trachoma now in the Northern Territory and elsewhere as there was before Fred Hollows began his work, and I find that very disturbing. Because you remember I said that part of my plan was to train individuals in each community. So it leaves me even today with rather some bitterness.
One more time, what causes trachoma?
It's a special organism, a special type of organism, like a germ, that does it. There's a very important role of poor hygiene too. It's not just the organism, but it can be very easily treated and should be treated.
Is it caused by flies, or is that not the same thing?
Flies spread it, and flies are attracted to these eyes. You see these poor Aboriginal kids in particular, and their face are covered with flies in their eyes. I've removed maggots from ears, from noses, and believe it or not, even from eyes. In fact, I used to have a competition with a few of the doctors that came with me once or twice to see who could find the most maggots in an ear. Not nice. And strangely, when I was in Kipapedia as a miner, I did come across that problem, but I didn't know what it was. As I was working on the top of the shaft with the winch, hauling dirt to the surface, Aborigines, by divine right actually almost, used to go through the dirt that was pulled up to see if they could find little chips of opal that they could sell. And everyone used to allow them to do that. And they'd have women and children with them. And one day I saw this little boy, and he was in a mess. I hadn't seen anything like it before. His face was covered in flies, his nose was running, and I could see the maggots. And I couldn't help it. I stopped the winch and just automatically reached out for him so I could get a closer look at his eyes. But I made a mistake, you see. I didn't ask for permission or anything, and the mother thought that I was going to hurt him. And she hit me very heavily indeed, with an iron bar. And I was very disturbed by it because obviously this little fellow needed treatment. Well, a few days later, one of the miners brought an injured dog to me for treatment. The dog had a fractured leg, badly misplaced, compound fracture. And I operated on the back of a truck, sewed up the wounds, put on a bandage and plaster. I had some plaster with me. But I had to give the dog an anaesthetic. And I was fortunate because as soon as I finished the operation, the dog woke up within seconds, which was a coincidence, not skill. Sort of stood on his 3 legs, walked around quite happily. Now, I hadn't noticed that some of the Aborigines came and witnessed this operation. And shortly afterwards, I saw this boy being escorted by his mother, and she was pushing him towards me. And she wanted me to look at him. So I was able to clean the maggots out. An extraordinary event, really. I remember it very well.
Incredibly extraordinary. Sandy?
Okay, can you discuss breastfeeding and its importance and its role in prevention and all that?
Dr. Glenn Detman, not a medical doctor, he was a medical technologist with a doctorate, demonstrated to me that there were parasites in all these kids. Their gut was full of them, and abnormal organisms. So I had to learn a little bit about the gut. It didn't take me long to find out. It's very, very important. The moment a baby is born, unless there are extraordinary complications, that baby should be taken straight from the birth canal and put on the breast. Now you ask anybody who breeds pigs, if the piglets are born, and there's one more piglet than there is tits, and one piglet misses out on being immediately breastfed, then the chances of that piglet surviving diminish enormously. There's something special, colostrum and so forth, in breast milk, which is very important. If they get that immediate colostrum into their system, the gut becomes inhabited, of course it's sterile when they're born, becomes inhabited very quickly with very useful and very important types of bacteria. If breastfeeding is not immediate and not proper, and even sometimes with a human infant, just one drink of water is enough to spoil it, the gut becomes colonized mainly by E. coli organisms. And that's bad news. The chances of that infant surviving diminish, the chances of it developing gastrointestinal disturbances right throughout its life are increased, the chances of all sorts of infections and problems are increased. Now, this is all known, but still not universally practiced, which is quite incredible. Even things like allergies are reduced if breastfeeding is carried out properly. And this is the first thing that we can do to any newborn infant to maximise the chances of that infant being healthy for the rest of its life.
Where do those E. coli organisms come from?
Well, we all have them in our gut. We don't even know where the good organisms come from, believe it or not. They are actually either in the mother's teats or even perhaps in the breast milk sometimes. But they're not there before the baby's born. They just appear like a gift from heaven. Maybe in the last few years they have sorted that out, but I haven't come across any information that provides this. They're the lactic acid type of bacteria, the same family of bacteria that is used to produce yogurt.
Another thing related to that, it's my understanding that children who are breastfed, not merely at the beginning, but continuously have a lower rate of otitis media. Are you aware of that, and can you talk about that?
I'm very aware of it, indeed. A much lower, you see their immune responses are better, and the incidence of things like otitis media, any disease you like to mention, and some people think even in later life the chances of them getting cancer early and heart disease early and so forth are reduced. I can't claim to be an expert in that field, but that is apparently what it is.